Welcome to Learning Pharmacology, Shorts, with me, Nurse Myron. And today, we will be learning about drug names. For our full disclosure, I am not affiliated with any of the manufacturers of the drugs or other items mentioned in this lecture. The mention of such brand names are only in passing and for educational purposes only, and are not for commercial promotion. I have no actual or potential conflict of interest in relation to this presentation. Drug naming, or drug nomenclature, is a standardized system of naming medications. It is designed to avoid confusion, thereby enhancing patient safety. In general, drugs are known by three types of their names. The first is the chemical name, which describes the chemical formula or structure of the drug. Second, generic names are also known as your international non-proprietary names. They are universally accepted and recommended by the World Health Organization. These are used in scientific literature and formal communication, such as patients' charts and prescriptions. In the Philippines, generic names are always written in lowercase letters. Lastly, we have the brand names or the trade names. Sometimes these are known as the proprietary names. These names are given by the manufacturer and are often trademarked. These names are used for marketing. In the Philippines, they always begin in uppercase letters. So let us take one very common and very popular drug as an example. The chemical name is your N-acetyl para-aminophenol. The generic name of this drug is paracetamol here in the Philippines and in most other countries in the world. In the US, however, it is known as acetaminophen. Now for the brand names, these are just some of the popular brand names available here locally, which includes Tylenol, Biogesic, Panadol, Calpol, Dolan, and even Tempra. The use of these names, especially the generic name of drugs in the Philippines, is stipulated in Republic Act No. 6675, known as the Generics Law of the Philippines, promulgated in the year 1988. Here it is clearly stated that generic names of the drugs must be used. And if ever brand names are to be used, they must be included inside parentheses. Brand names can supplement the generic name for clarity but should never replace the generic name. So for example, when a physician will write his or her prescription, it should go like this: paracetamol, lowercase p, then Biogesic, the brand name, with the uppercase B inside parentheses. For packaging, here in the Philippines, generic names are always inside a rectangular box in the label or in the package, and the brand name is always placed under the generic name. So you can see here that the word paracetamol is clearly indicated in the packaging and inside a rectangular box. The brand names are placed under. Thank you very much, and I hope that you learned a lot today in Learning Pharmacology, Shorts, with me, Nurse Myron.